Well, thank you so much. And thanks to everyone for coming. I apologize, but the only way my sound can work is if I wear this little microphone headset. So don't mind that. But we are going to get started here. So I will at times ask questions. If you want to pop on and give an answer, you can feel free, or you don't have to show your face if you don't want to, but you can turn your volume on. Oh, here we go. So our topic today is mindfulness, and I wanted to just ask if this is a topic that people are familiar with, or if they've never heard of it and they're interested, or just what you might think it might be, that kind of thing. I don't know if people are familiar with it, so I'm just curious.
I'm familiar with it.
Okay, and how are you familiar with it, Jill?
I have an app called BC Healthline, which is a discussion from women all over the United States that have had breast cancer, and they talk about it on there.
Oh, good. Okay, great. And is there anything specific that you find helpful since you've been
No,
looking into it?
well, they just reiterate over and over how you need to keep care of yourself
Mhm.
first and
Right.
then everybody else. So, that's one of the things they talk about a lot.
Yeah. Okay. All right. Well, thank you. Okay. So, what is mindfulness? And I know there's others on here that aren't as familiar with it. So, we will just kind of keep going. Mindfulness is a state of active, open attention to the present. This state is described as observing thoughts and feelings without judging them as good or bad. This is what Psychology Today said. Um, so, I think the busyness of the world that we live in right now is it's very easy to get caught up and kind of get on, pilot mode when you're going through things and through your day. And mindfulness is essentially a way to try to be present in the moment, in whatever moment that might be. And so it's just making a conscious decision to focus on your surroundings. That can be, focusing on your breathing, if you're, coloring something, if you're taking a walk, reading, or even if you're eating, being mindful about eating is something that is talked about too. And you'd kind of do it for a set amount of time. It's natural for our minds to wander, and there's no sort of penalty for that here. I think that's just a normal part of it. It's acknowledging that your mind might be drifting and wandering, but then coming back to the present and what you're trying to focus on for however long you're trying to do that. So that's kind of what our focus for mindfulness is. Um, so awareness and acceptance. We want to notice our surroundings. We want to observe, name, and accept them. So you're really kind of, and it might sound strange to do or not natural at first. And I think that that's probably the way that I felt about it too. But it's a way to try to not let things go by without, observing them and noticing them and being more intentional about your everyday life, whatever that might be. So it's not intended to block out things that are unpleasant. And I think, our focus here today is, breast cancer survivors. And obviously there's a lot of things going on when you have cancer, when you have breast cancer. And so we're not trying to not acknowledge those things that aren't the best that are going on, but we want to observe them, accept them. And it's a way to be able to cope better in life in general when you have emotional stress or physical stress, that type of thing. um is there any aspects of the cancer journey that you find challenging, sort of probably physically, but then also like mental health wise, that are kind of a block for people at times? There's things that come up that I know that other patients have talked about that are uncomfortable with breast cancer. There's certainly the physical changes that you experience as a woman. I think that's hard for us. It's part of our identity. And it's a matter of getting that information, knowing what to expect and accepting that, and being able to to be okay with the circumstances and to be able to cope with it better and to talk about it as you continue and go through, because we all know that it's a challenge, and accepting things that are happening are not always easy. But if we acknowledge them and face them head on, then in the long run, the coping will be better. Okay. So mindfulness is a tool to use to empower you to use your body and your mind in practical ways to increase your overall well-being. The goal is to empower you to stay more engaged in your life in a healthy way, to create fullness, and rather than to focus on the negative. And I think that it can be easy to kind of go down a rabbit hole when we're not feeling great about our circumstances, whatever that might be, but trying to center ourselves and stay focused and remember the other things that are going on that we can be thankful for, even the people that may be stepping up to help you through these times. One of the big things that we can do is breathing. It's scientifically proven to help and engages the sympathetic and the parasympathetic nervous system. And I do have a visual coming up for this that is a little helpful, but I wanted to explain this a little bit more first. So we have the largest nerve in our bodies is the vagus nerve. And it's the longest nerve, and it connects from the top of our heads, and it curls around our neck and down through our heart and into our digestive system. So it's this one long continuous nerve. And, I think when we think about when we're nervous or anxious about things in life, and then we feel like we might not be able to eat. And, if you think about any of those times in your life that you felt that way, it kind of makes sense that all of this stuff is connected. And so we're trying to tap into that to try to help our body relax through these emotional, more anxious times. The sympathetic nervous system activates our fight or flight response during a threat or perceived danger, and our parasympathetic nervous system restores the body to a state of calm. So when we focus on, air coming into our body and then releasing air through our body, that's kind of engaging that whole system to try to help us to be able to cope better. So here's that visual I was talking about. I think this is a helpful visual to look at for the parasympathetic system. And you can see all the things that it touches and connects to, which is how, our heart rate and all these other things, that it runs from our brain all the way down to our digestive system. So when we breathe from the diaphragm, it puts pressure on this vagus nerve and creates this relaxation and engages our parasympathetic nervous system. So research has shown that just 20 minutes of this diaphragmatic breathing is all that is needed to activate and oxygenate the mindful and thinking part of our brains, which is in the prefrontal cortex here. So when we feel high levels of fear or anxiousness, tightness in our chest, neck or belly, rapid heartbeats, these are all things that are going on here in this vagus nerve. And we can get our serotonin, that feel good. Oh, I'm sorry. Were you saying something? Nope. Okay. That feel good neurotransmitter, the 95% of that is in our stomach lining and intestines. And it only takes 20 to 30 seconds to get it through our bloodstream up through that whole system to help us to be able to relax and calm ourselves in those anxious times. Okay. So what are benefits of mindfulness? It can really boost your health in all sorts of different ways. It increases your immune function, decreases pain. It can decrease the inflammation at our cellular levels. Focusing on the past as a symptom of depression and focusing on the future as a symptom of anxiety. I think these are things that we're kind of dealing with when we're going through these things. And mindfulness, again, helps us to try to focus on what's going on in the here and now. It can boost our happiness. increases positive emotions. It can decrease that depression and anxiety, decrease the stress. Can boost our social life. We feel more like we want to engage with others, especially because you can probably feel more at ease talking about the things that you're going through and experiencing. Again, knowing that not everyone's going to understand all the time, but if you have a better centered grasp on what's going on for you and what's going on, then this can really help you to feel okay in those interactions and be able to share maybe a little bit more, just share what you want, and be okay with that, knowing that you don't have to share everything with people. It can boost our self-control, improves our ability to regulate our emotions, improves your ability to be introspective. I think when we, even I've found myself, doing this more and more as I've been preparing for this talk and getting ready for it. I think even in small moments at home, if there's a stressful situation, I can identify why I'm feeling the way that I am quicker, and maybe kind of understand why my family might have responded in that situation the way that they did. And it helps you to be able to feel a little bit more balanced in those stressful situations. Okay. It improves our productivity, increases the focus and attention, can improve our memory, which can be a struggle at times, especially, with the chemo brain and other things that are going on, and you're just feeling scattered because of all the appointments and those sorts of things. It can keep you real. Once you begin to know your mind, you become more authentic, like I said, with other people, perhaps more humble. You realize the stories or the soap operas that you put your mind through is not something that's necessary. You can just stay focused in the moment and not worry about conversations that may or may not take place in the future, that type of thing. Okay. So practicing mindfulness, I like this visual here. I got this from another counselor here in the hospital. If you look at this, the bubble on the left with all the stuff going on, I think that's kind of how our minds feel a lot. There's so much going on that we're trying to process. And the whole practice of being mindful is to just look at our surroundings, look exactly where we're at, what we're doing, take note of things, and try to be intentional about our surroundings and what we're going through, and being okay with that and putting that other stuff to the side. I think a lot of people with mindfulness feel pressured, though, in some ways, that they have to be able to think this way all the time. And that's definitely not what this is about or what it's saying. Certainly we have our moments, in life where we have to just do what we need to do for work or for treatment or whatever it is, a doctor's appointment. And we're just saying mindfulness is a practice that you practice when you can, you're intentional about it. And then that does lead into changing that behavior for you down the road. And we'll get into that a little bit more here in a minute, but it's not a pressure to feel like you have to be able to do this 24/7. It's not that at all. So actually practicing mindfulness, you're again intentionally paying attention, and you can do this anytime, anywhere, while you're doing anything, and try not to hold on to things. So one way is through meditation, if that's something that you've ever done in the past and that's been helpful for you. It's certainly, I know that meditation is one of those things that a lot of people aren't comfortable with maybe initially, but it's kind of the quieting of the mind. And you can do this while you're sitting, standing, taking a walk, that kind of a thing. Contemplative prayer is another one, and there's all sorts of different religions that do this in different way. In the Christian setting, it's a centering prayer using the rosary. The Jewish faith has Shema that they practice, or Islamic faith, the Sufi practice. So there's definitely any kind of spiritual prayerful component that is important to you and your faith. That's certainly a way that you can practice it as well. Through movement, you can do yoga. There's all kinds of martial arts, spiritual dancing, but it also can just be going horseback riding or taking a hike, riding a bike or walking, any of those kinds of things. You can practice mindfulness while doing those things. So it's not, again, a spiritual practice. It's less formal than that. It can just simply just be paying attention to your present and what's going on. And like I said earlier, some people find they can be more mindful, like if they're coloring, there's all kinds of coloring books out there, adult coloring that you can do that a lot of people find relaxing. That's definitely one way you can do. Sometimes driving, although you want to make sure you're paying attention to exactly where you're at and where you're going, that kind of thing. But it's certainly something that's flexible, and there's not a lot of rules to it. You do what you're comfortable with and what you feel you can do. So another thing that I wanted to talk about too was this idea of this wise mind. And I don't know if sort of on the counseling end of things, if you've ever heard of cognitive behavioral therapy. There's another therapy called dialectical behavioral therapy, which is modified version of the cognitive behavioral therapy. The whole idea behind both really is to change the way our minds think about things. And with this dialectical behavioral therapy, it's kind of our response and our way to cope when we have negative emotions. And we're trying to translate the way that we're coping in these situations when we find ourselves in high stress. And obviously in the cancer journey, there are a lot of stressful moments that you're going through doctor's visits, if you get a CT scan, waiting for any kind of results, those sorts of things. If you're going to have surgery, radiation, I mean, all of these things cause high anxiety, high stress. And so we want to try to think through the way that we're thinking going into these and trying to change our behavior and our mindset going into it so that we can be able to relax and know that we're going to receive the information and be able to ask the questions in a way that will be helpful and moving forward. And this wise mind is one of the things that the dialectical behavioral therapy talks about. And so we kind of want to find a middle ground. A lot of folks find themselves, as you see, in this rational mindset where you're approaching everything kind of intellectually, and there's not a lot of emotion behind it. You're just trying to get the facts and stay focused on that, and you're not allowing yourself to feel a lot. But then there can also be the other side of that, which is the emotional mind, and you're being reactive. You're not really thinking through the logistics of what's being said. You might be responding based off of emotional things that have happened in the past, which is certainly understandable. But again, the idea is trying to find that balance. And so they call it this wise mind, where you're intuitively thinking, you're arranging and balancing between these two rational and emotional worlds. And again, being present in the moment and trying to stay centered and focused on what's going on right in front of you, or what is maybe your next step, and what are the questions that you have around that to be able to engage, but not to feel so anxious that you feel like you can't cope. But it's a slowing down of your mind and using healthy coping skills so that you can stay calm and get through the moment and hopefully change kind of that reaction that you might have. I'm just going to pause here before we go forward. Does anybody have any questions at this point, or any comments about anything that I've talked about so far? Okay. So I thought I would do a couple of examples of mindfulness. I'm just going to put this kind of slide up here. And this is honestly something, this first one is something that I've actually found that can be helpful with kids too. Because I think, kids aren't able to process information, especially more difficult things in the moment. And so this is a very tangible, it's called the 5-4-3-2-1 method. I don't know if anyone's ever heard of it, but it's something that I find to be helpful to just calm and relax your mind, especially in a very high stress situation. So I'm just going to walk through this one with you. You don't have to speak up or respond, but I'm going to pause in between each thing just so that you can, wherever you're at, if you're at your desk or your living room at your home or wherever you are, and just try to walk through this exercise with me. So this is called the 5, 4, 3, 2, 1 method. So we're going to start with number 5. We're going to name 5 things that you see right in front of you in your present space that you're at right now. So just notice 5 things around you and just, think about them, say them in your mind, or you can say it out loud. If you're on mute, you can do that too. And next we're going to talk about 4 things that you can feel or touch, things that feel differently or things that you can actually physically touch that are right around you. Okay, and next we're going to talk about or name 3 things that you can hear that are in your current space. And I'm sure we all are hearing different things and it's background noises where we are. So name 3 things that you hear. And then we're going to name 2 things that you can smell. Are there any specific smells that you can notice around you right now? And then last, we're going to end with 1 thing you can taste. Is there any taste that you have in your mouth? Maybe from something you ate from lunch or a snack that you had. So as you can see, that method is very tangible about things that are right around you, that help you. Again, it can help you calm down and focus and center yourself if you're in the middle of just feeling anxious about something, and then you can proceed into whatever you're doing. I've done this with a kid who's feeling pretty anxious about a situation that they were currently in, and it was at first the child was kind of like rolling their eyes at me like, this is not going to be helpful to me, why are you doing this? But then once we walked through the 5 4 3 2 1 method, it was helpful to just kind of step back from the present moment that we were in and the stress, and that they were able to really, take a step back and really be able to focus on where we were and what we were doing, and why they were feeling stressed. And we were able to talk through that moment and what was really kind of behind everything. So that's an example of one. Another one, and we only have 2 more. This is called squared breathing. So I'll walk us through this one again. We're going to inhale, hold, and exhale our breath for 4 seconds. So we'll inhale for 4. 1, 2, 3, 4. Now hold for 1, 2, 3, 4, and exhale. 1, 2, 3, 4. Again, simple, just a method to be able to engage that parasympathetic system that we have, that we know kind of connects our whole body and mind together. And it helps you to be able to just take a moment, and when you're counting, and that tries to kind of distract you from all the other things too, but it helps kind of engage our whole core and work through a moment of stress. So that's another example. And then the last one, I'm actually going to have you close your eyes, and I'm going to sort of read this little exercise to you. It's called the stone flake exercise. So if you want to close your eyes, and I'm just going to read the story, and it'll kind of walk you through how to think about things here. So we're going to imagine that we are seated next to a crystal clear lake on a beautiful sunny day. Imagine that you are a small flake of stone chipped from a much larger rock that someone has gently thrown into the center of the lake. Just a little toss. You are gently floating there on the placid surface of the still water. Now you begin to gently and slowly float downward in the cool water toward the smooth, sandy bottom of the lake. Notice the look and feel of the water as you gently float to the bottom. Notice the feel of the smooth sand as you lightly rest upon it. Become aware of the peace and serenity at the bottom of the lake. This deep stillness and serenity is the calm center of yourself. Allow your attention to settle into this calm centered place within. All right. So those are just a couple examples. Like I said, there's all sorts of examples of mindfulness that you can do. And again, it's really each and every one of us are individual. We have different likes. There's things that are more comfortable for any of us to feel more at peace. Certainly, even my husband and I are very different from each other. We're opposites. I love to clean. He loves to fish and paint and do all sorts of things. And so neither of us really like to do either of those things, but we can find our own peace, and we can find moments of mindfulness in those things that we enjoy. So it doesn't have to be, if it's something that is helpful for someone else, it doesn't mean that it has to be for you. So it's you finding what is helpful for you. And I found this quote and I like this. The only way to beat cancer is to accept the reality, embrace the pain, and find the courage to move forward one day at a time. So I thought this was a good way to end and think about moving forward with wherever each of us might be, um, and just hopefully taking this tool as something that we can use to be mindful in the everyday things that we're going through, and the treatment and the what's to come and those sorts of things.